there's no one thing that they have to have, but they better have something, whether it's board certified by the American Board of Hair Restoration Surgery, or the number of years experience that they've been working consistently in this profession. They do enough of them. If you do one a month, that's not enough for a staff to be properly trained. So I'm not saying they have to be doing 20 a month, but they better be doing 4 or 5 or 6 consistently a month, so that the staff and the doctor stays current, that he goes to the meetings. Sure, he might miss one meeting every 3 or 4 or 5 years, but it should be a person who's going to the meetings, meeting with colleagues. A lot of times the best part of the meeting is just sitting around in the restaurant and talking. And you're talking with a guy who's been doing it for 30 years. You're talking to another guy who's been doing it for 5, and you get different ideas and things. Geez, I didn't think of that, or whatever. So you want somebody who goes to the meetings, somebody who has certifications, somebody who's done reputable work, and they have their pictures to show you, not 50 books since 1910 with pictures that every doctor that's ever worked there has done. You want to see the pictures that were done by that doctor. And if possible, and it's not always possible, but if a person is willing to take the time to meet with a patient who's had it done, they can examine their head, they can look at them, they can see them, they can talk to them on the phone. There's some red flags. If the person refuses to tell you what their certifications are, if the person refuses to tell you the names of, and sometimes there are patients who don't want their name out there, but all of us have, or should have, a select group of people that are willing to let their name out there, that are willing to talk to a customer. And if you ask for a patient's name or some contact, I don't have any, you should have one. You should have several people that, just to get on the phone, hey, did you get what you wanted? How does it look? Can you send me a picture, or can I meet with you at a restaurant or something just to see what it looks like? So there's levels, and you want to make sure that the place looks clean. I mean, I know it sounds crazy, but you want to look around. Do the guys and girls working in the office look clean? Do they look professional? They don't all have to be wearing white lab suits and whatever, but does it look like a place that's a real doctor's office? Is it the walls clean and the floor clean, and does it look like there's a legitimate business going on? It's not in the back of your garage. I mean, there's a lot of crazy stuff that goes on, unfortunately, and you want to make sure that it's a reputable place, and that you're getting reasonable answers, and the person, when you're talking to them, as I said, and the other thing, it doesn't come up sometimes in the consult, but you should be aware. What happens after hours? What happens at 7 at night? I lost my little paper that has my instructions. It's my first night. I've never had this done before, and what happens? Do I get a phone that rings and rings and rings? Do I get an answering machine? Or in my practice, you get me. I'm answering the phone. So you call them 10 at night because you can't find your little paper that tells you what you're supposed to do. I'm going to pick up the phone and talk to you. And if it's 2 in the morning, I will. 24 hours. A human being's going to pick up the phone and talk to you. So, and that's a little thing, but that first night, and you lose your instructions, or you don't remember exactly what somebody told you, you're going to be very thankful that you're getting one of the people who worked on you, 99% of the time me, to talk to you, and not a machine, and you got to wait now till 7 or 10 in the morning for the office to get the message and call you back. So, that's all part of the care and service. A patient is paying a lot of money, and they should expect that you're available to help them pre and post-op.